Bacteria play such an important role in our lives that sometimes we do not realize how fortunate we are to have bacteria in us. These microorganisms can keep an individual healthy or not. Fecal microbiota transplant is a process that patients with recurrent C. diff infections are relying on. Bob Russell, a director of infection control and director of sterilization of hospital in Miami, says that 80% of the patients that undergo this procedure find a cure. Russell named her article "The Power of Poop," and it is amazing. I think that she realizes how important and how powerful fecal matter can be. Today, I'll be informing you what is Clostridium difficile, what is exactly fecal microbiota transplant, and how do we prevent this infection. What is exactly Clostridium difficile, more commonly known as C. diff? Miriam Boyle, a medical surgical trauma nurse, says that C. diff is the most common healthcare associated infection. She says also that this usually happens in the transfer from the hospitals to the nursing homes because they don't know how to contain this infection. It's also proven that it's caused by overdone antibiotics. Antibiotics also that are not needed. They come and alter our normal flora in our stomach, and they cause a raise or the growth of a toxin called A and B that damage the lining, the mucosal lining of our gut, and then results in diarrhea. So diarrhea is one of the first symptoms that we see with patients of C. diff. Now we're going to learn what is fecal microbiota transplant. Fecal microbiota transplant is taking the feces of a healthy individual and putting it into a infected patient of C. diff. We know that a patient with C. diff has the altered normal flora in the gut. So what researchers have done is that they've gone and the process that they've done is that here in the gut they insert the fecal matter through an enema. It could be done through an enema. Put it in the enema just like a regular enema is done with a bottle, and put it into the gut, and will be resulted in a transplant. That it will be considered a transplant of fecal matter in the gut. So the gut is where most of the bacteria, the important bacteria we hold in our stomach, and this is how they do a simple transplant. I am sorry. So we are now going to learn how to prevent these infections. So we are first going to prevent this infection by doing safe transfers from hospital to nursing home. Following protocols is very important. Following protocols of our facilities. Secondly, using proper PPE, proper protective equipment like gowns, gloves, and all these things that are important to contain the infection. And lastly, we are going to contain this infection by washing our hands with soap and water. It's the most effective, it's a low cost preventive manner. They do it to wash our hands properly, and we are going to be able to contain the infection. And last, I'm going to be talking about how effective is this procedure. So BMC Medicine says that fecal microbiota transplant is the best cost-effective treatment that there is out there. It's low risk, and it's compared with antibiotics that is very, very effective, and it's not gonna harm the patient. It is very effective. So thank you for your attention, and that's it for tonight.